Good morning, everyone. Before I start talking, so I can see you all, and my notes, I need to do this. So excuse me for our glasses break. Welcome, everybody. It's absolutely amazing to see humans meeting, doing elbows, doing fist bumps, some of us even hugging, because quite frankly, we need that human contact after everything that we have and continue to go through. My name is Godfrey. I'm Chief Executive of GS1 UK, and this is my first healthcare conference because obviously we've been stuck at home wearing Lycra. So actually getting the heels, sorry ladies, I'm going to say, getting the heels out has been amazing. And actually remembering for those of us who are girls and have to speak to wear a belt so that you just don't have that uncomfortable moment. So I have been given some notes by Glenn, which I will mostly follow, but with a little bit of a Glaswegian spin. But I will try and get all the key points and then he will mark me later as to how well his chief executive did on her first outing. So my welcome to all our delegates, our partners, our sponsors, everybody who's supported GS1 UK, and all of you who do such an amazing thing, and particularly in the last 3 years, I can only say thank you from all of us who have used the NHS and whose family have used the NHS. So my thanks to everybody, and thank you for coming here today to support each other and support us. I'm hoping you'll have a great time. I'd also like to say thank you particularly to our partners and sponsors for coming back. Now you're all here. And to Ingenica, who are our platinum sponsor, thank you very much. Now we get to the first Glenism. And I expected to see it written down, and sure enough, he opened with the Cluedo Gambit. And for those of you who heard Glenn speak, you will know what the Cluedo Gambit is. It's who did what, to whom, with what, and where. And we're not talking Colonel Mustard with a candlestick in the drawing room. We're actually talking about what our standards allow all of you to do to keep people safe and well, which is the authentic identification of, another Glenism coming up, people, product, and place. And for those of you who, like me, are new to this, that is eye-opening, quite frankly. So thank you to those of you who've actually welcomed me into the hospital state in action. So I now know what happens when a patient walks in, being tracked from the very minute they walk into the hospital, through surgery, back home, and unfortunately, should something go wrong, being recalled back because the product that's in them, something went wrong. And that's what we're here to talk about today, is the power of our standards to keep people safe and well, and to save lives, and yes, to save money, because having an efficient, effective health service that keeps people safe, that traces everything that happens to them, is the power of our Scan for Safety program. Obviously, this is the first time we've had a conference in 3 years, and I think it's safe to say that we've gone through some interesting times. And I just wanted to go slightly off-piste for a minute and point to something that will come up on the screen. We're supporting at GS1, both UK and around the world, the various Ukrainian refugee and humanitarian campaigns. We're supporting the DEC one. We're going to be using QR codes, so we're using our own standards, so you can find one and scan it. Please give as generously as you can. We're encouraging our staff not just to give of money, but to give of their time. And I'm sure all of you are doing the same, because what is happening somewhere east of us and somewhat closer than we ever expected in our time is very, very scary. And anything we can all do to help, gratefully received. Back onto script. I'm going to do the bullet points. I really am going to do the bullet points. So what else has happened in those 3 years? Well, we've had a lot of very interesting reports about what all of you do using standards. We've had Baroness Julia Cumberledge's report, and Julia's joining us today, and I will do the official welcomes in a minute, which is what happens, unfortunately, when things go wrong. In this particular occasion, predominantly to women. We've had the Scan for Safety report, talking about the reality of using standards and how we can roll it out, again, to save lives and to save money. And then very recently, we had the Digital Clinical Safety Strategy. That's not easy to say, even after 2 coffees this morning. And the coffee's not bad, I have to say. All of those obviously will have an impact on what we do. And we're looking forward to discussing with our partners and all of you, the authors of those reports and the people using what came out of it, so we can learn from each other. So make sure to ask questions of the speakers and each other. Make sure that you network and enjoy this physical experience. Say hello to our 60 amazing speakers. The fact that so many of you said yes and were willing to come and actually share your knowledge is incredible. My thanks to those of you outside of England. I can say that with this accent. We are genuinely taking a Four Nations approach to everything that GS1 UK does and to everything we do with the NHS across the Four Nations. And the NHS is our single biggest member and partner. Larger than any of our other members. We obviously support SMEs of all sizes and retailers and construction, but the NHS is our single biggest partner and member, and we're really proud of that, and we're really proud of the work that we do with all of you. So I think I've said enough. I'm hoping that I've said everything that Glenn wanted me to do, and I'm getting at least an 8 out of 10. And I would therefore like to welcome our first speaker to open the event, Baroness Julia Cumberledge. Welcome to the stage.